to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Pho, founder and editor of KevinMD. Today in the show, we have Tayson DeLengocky. He is an ophthalmologist, and he wrote the KevinMD article, "Why is the world's first universal coronavirus vaccine not in the FDA's toolbox?" So we'll get
Yes,
into your article in a little bit, but first off, can you just share your story and journey to where you are today?
I'm from Vietnam and live in France and moved to the US and took the SL and went to community college, transferred to University of Texas at Austin, the UT system. And then I resided and stayed in Texas for about 14 years before I moved out of Texas, for medical training, which took me to Michigan, New York City, and working in Illinois, and then now working in Southern California.
So you've written several articles on KevinMD about Covaxin, which is the predominant COVID vaccine in India. Your KevinMD article is titled, "Why is the world's first universal coronavirus vaccine not in the FDA's toolbox?" Now, for those who didn't get a chance to read your article, can you just walk my audience through it and share the story of why you decided to write it?
I received the Pfizer vaccine the very first day available to us. So I had the two Pfizer plus the booster. And when we start talking about the fourth dose of the same thing again, and I'm thinking why we are doing it doesn't make any sense to me.
Mhm.
I follow up with the vaccine in India, and it is a whole virus inactivated base virus created. So, and it has very good data, and it's one of the vaccine candidates to the FDA in order to be, to be commercialized in the US. So, and I see that the media doesn't cover something that good, and the medical community doesn't know. And to be honest with you, that through almost 3 years into the third year of the pandemic, the public health policy official has been changing their tune all the time. And even you take from Europe, policy is different from the US, the Australia, New Zealand is very different. So if we have the same data, the same fact, but the interpretation is very different. And we as doctor, and I see that we don't have a voice in advocating for our patient, to advise our patient. I remember from the very first day of the pandemic, the officials were telling us which is harmful to wear masks, because we don't know, the public don't know how to adjust correctly the mask. It would be harmful. And now you see, so the tune change over time, and we are not doing any better in the third year of the pandemic than the beginning without any vaccination. The number of death, the number of case, and the number of hospitalization speak for itself. So we have the three best vaccine claimed by, by our American scientists, or Dr. Fauci claim is the best, the most desirable, the most desired vaccine in the world. And we don't need anything else. And I think that is a disservice to us, to the American public, to have the option of what vaccine to get. Now, Covaxin has been applying to the FDA since June of 2021. So we need to allow all the good vaccine to come to the US shores, or at least to give them a chance. After 6 months of application to the FDA, was not reviewed. And it was surprising to me. And Covaxin has been administered in India, in some other countries, 250 million doses already. So the data speaks for itself, the safety speaks for itself. And it has been approved by the World Health Organization already. So why the FDA doesn't approve for a clinical trial in the US, so that we can see if the efficacy in the US, so that we can have something for the American public. So that is the frustration that I have. And I see that there is complete blackout of the media and also from among so-called expert in public health. And to the point that we see if something is good, working, and there is no adverse effect like myocarditis. And recently, the CDC finally released the study from June to November of last year in the state of California and state of New York that the natural immunity, meaning previous infection recover, provide more protection to the Delta variant than the mRNA vaccine combined. So you see that the immunity, the natural immunity, is provide better than the vaccine itself. Of course, when you combine the two together, you have a better protection. But this is a whole virus inactivated. So it's the closest form of natural immunity that we can give to the patient without causing the disease. And why don't we have a chance to that? I don't know the reason. And big pharma, there is the intertwining interest with each other, media and everything. So you don't see even the medical community, physicians don't know anything about Covaxin to advocate for the patient. All I would like to is that the public deserve the choice.
If you go to the CDC website, I think that there's a lot of conversation regarding natural immunity. I think what the CDC says is that natural immunity is a little bit more variable and less predictable than immunity you get from vaccines. But I wanted to ask about the Covaxin versus the mRNA platform. Do we have any head-to-head studies comparing their efficacy?
No. All it has been proven that the Covaxin has been efficacious against all the variants so far. During the clinical phase 3 in India, during the search of the Delta variant in India, and it is the only vaccine trial, is provide 65% efficacy against Delta with the 2 dose. And in the lab, with the 3 dose, the booster, after 6 months, you have 100% of immunity and 100% of neutralizing antibodies specifically to Delta variant. And with the booster, it provides 90% of the neutralizing antibody to Omicron. So that speaks for itself. And if we compare the rate of the case, the number of cases, the number of deaths, the number of hospitalization in the US compared to India, we can see that's the fact. The reality speaks for itself.
I think one of the pushback that I read online is that they say that we have enough vaccine supply in the United States, and why do we need yet another one? One thing that I think may be helpful is because Covaxin is a more traditional vaccine platform, do you think that Covaxin would be better accepted by those who are resistant to the mRNA because they think it's a newer platform and more hesitant to take it? Do you think that if Covaxin was approved here, we can use that and perhaps sway some of those who are hesitant to take an mRNA platform?
Yes, definitely. That's what I want to offer people have a choice. The most common reason why people refuse to get vaccination is the mistrust in the government and the mistrust in the public health policy and the mistrust in the new technology. That's the key issues. And yes, Covaxin as a traditional created platform, it can help to sway those people, those hesitant. And there are other, like China has also the inactivated virus vaccine. But Covaxin is the only candidate which want to be in the US and in the North America. So it's tried to get through the FDA approval. But the thing is, 6 months already and no clinical trial allowed. Do you think that 200 million people receive the Covaxin without severe side effects. Yes, we have enough vaccine, but now they are starting to talk about creating a universal vaccine that would able to adapt to the new mutation. The reason Covaxin is already universal because it has been proven so far efficacious against all the variants and has received full licensure in India by the Indian FDA for full licensure, meaning fully approved. Okay, so, and it has been recommended by the expert committee for approval for use from age 2. And recently, for the past month, Covaxin has been used on kids from 15 to 18. 40 million doses have been administered without any myocarditis. In Europe, some countries say no Moderna for people under 30. And in the US, we are trying to push for pediatric use. So are we looking the same data with different interpretation? So we're talking about the Europe, we're not talking about the third world. We're talking about Europe, Germany, Sweden, France, Spain. Why they are saying no Moderna under 30?
We're talking to Tayson DeLengocky. He is an ophthalmologist, and he wrote the KevinMD article, "Why is the world's first universal coronavirus vaccine not in the FDA's toolbox?" Tayson, what are some of your take-home messages that you want to leave with the KevinMD audience?
We demand that a good traditional form of vaccine, which has been proven so far for the past year, and even the Indian Prime Minister got the shot himself, rather than order Western-made vaccine. And I think it's time that for the FDA to allow a clinical trial phase 3 to see if Covaxin would be a better fit for our population in the US. And we have been complacent over the past year because we have vaccine, okay? But unfortunately, as of today, our situation about the pandemic is worse than at the beginning. By looking at the number of cases, looking at the number of hospitalization and death. We have higher number of cases in death, in hospitalization than the beginning without any vaccine. And even like as you can see, the monoclonal antibody was withdrawn from treating the COVID because it doesn't work anymore. Technology allows us to be able to go down to the molecular level, or now the gene level to target a specific protein. But we are treating a disease, but we are not treating the whole person, or we're not treating the whole virus. We're treating a specific protein. So it's just like as in our healthcare system now, we're treating not the patient, we're treating the disease, the symptoms, but not as a whole, the overall, the holistic approach. And yes, the traditional platform of vaccination, creating the vaccine, even for Covaxin, it took them about 18 months to achieve that, from the beginning to the phase 3 clinical trial. And even for them, they had a very vigorous review by the World Health Organization. It was delay after delay. So it was thoroughly reviewed by them. So the safety data is there, and the application is there in front of them, in front of the FDA. I don't want to get my fourth booster with the same technology. I want a more universal. And that's why the whole reason about now people, even Dr. Fauci start talking about universal vaccine, because we have to catch on the mutation. And if you have the whole virus being, stimulating the immune system, then you have more chance to be able to have some efficacy against the mutation.
Thank you so much for sharing your time and insight. And thanks again for being on the show.